Lead is a type of metal that in the past was used in pipes and even paint. It's banned in most consumer products now because of its toxicity. Children are exceptionally vulnerable to lead poisoning due to their developing brains.
And lead, when it is ingested or inhaled, actually crosses the blood-brain barrier and gets to the brain. And so for young children, that can have devastating impacts on the development of their brain. It can cause permanent loss in IQ.
But trace amounts of lead still manage to make it into water systems and can be present in older buildings built before 1978. This Washington Department of Health map shows lead exposure risks based on the age of homes and poverty levels. The purple areas are considered high risk.
Lead poisoning is still an issue. A lot of people think, oh, that's something that's way in the past. It's still an issue.
Dr. Jay Fati is the plan president for Molina Healthcare of Washington. Molina provided a $40,000 grant to Seattle Children's Care Network to buy 6 lead screening machines for kids in Washington clinics.
By directly putting the screening test in the clinics should, just from a convenience standpoint, if nothing else, increase the access to Washington families to get their children screened.
The Seattle Children's Care Network was very fortunate.
Dr. Kenesha Campbell is a pediatrician and chief medical officer at Seattle Children's Care Network. Dr. Campbell says most of the time it's difficult to recognize signs of lead poisoning in kids as symptoms are very broad, such as fatigue, irritability, headache, or abdominal pain.
You can't tell that a child or an infant has been exposed to lead unless you get to the level of lead poisoning where your lead levels are extremely high. So that's why screening is really important.
In Washington, only 7% of children under age 6 have been screened for lead poisoning, according to data from Washington DOH. The new machines from the grant will be used at clinics in areas known for high rates of lead exposure, a high percentage of Medicaid patients, and areas with low screening rates.
That makes it much easier for patients to be able to get screening because for many reasons, patients may not be able to get to the lab or they may not want to go to the lab. So it's really important to have that ability in the office.
The screening machines analyze blood samples from a finger prick. Dr. Campbell says there's no known safe level of lead in the blood, but the point is to catch any signs early. For HealthLink, I'm Christine Pei reporting.
For a full list of which pediatric clinics will get a screening machine from this grant, you can text the word lead to 206-448-4545. That number's right here on your screen. And once you do, we'll be sure to send that list right to your phone.